Welcome back. This is Ask the Expert, and we are talking to Dr. Lisa Coppa Breslauer, MD, specializing in general and cosmetic dermatology. She's the head of the Laser and Skin Institute in Chatham, New Jersey. And we are going right to the phones. Call in with your views or questions at 973-267-9687. And we have got Ed France on the line. Ed?
Yeah, I want to ask you the skin specialist question.
Yes, absolutely.
Yeah, if you have like a melanoma that is considered, cancerous or precancerous, and they remove it, and the pathology report said it's in the early stages, but they want a second opinion, what does that mean? And if you have this, does this mean you'll have it in other areas of your body and you have to stay completely out of the sun after this?
That's a very good question, Ed. Pigmented lesions, melanomas, and what people sometimes refer to as precancerous, which could mean that a mole had some abnormalities, are not always black and white. There are some gradations, and the pathologists may defer to each other to decide, do they feel this is melanoma? What subtype of melanoma do they feel that it is? Because there's many different subtypes. Is it just atypical, or does it have enough abnormality to actually be considered a melanoma? And these are very, very crucial diagnostic questions that have to be answered. So sometimes it will be referred out for a second opinion. As far as staying out of the sun, anybody who's been diagnosed with melanoma, abnormal moles, or skin cancer or precancer really should exercise very good sun precaution or sun avoidance measures. And as far as being in other parts of the body, something that's early stage, if you're being staged for it and has not been determined to metastasize or have spread to other parts of the body, should not be in other parts of the body. However, once you've developed an abnormal mole, a melanoma, or a skin cancer, you are at higher likelihood of developing a second one. So you should have close surveillance, meaning skin exams, depending on the type of skin cancer, could be as frequent as every 3 months or as infrequent as once a year.
Okay, and
go ahead, Ed.
All right, and what kind of sunblock should you use, if at all? What, do you use the highest number? Or?
Well, numbers are important, but so is the ingredient of the sunscreen, because what we're looking at now, what we've found is that you want something that blocks ultraviolet A and ultraviolet B. So there are the physical sun blocks, which are this titanium dioxide and the zinc oxide, which tend to be a little bit heavier, and they're a physical block from the sun. They actually prevent the sun from contacting your skin. So I always recommend to my patients use at least a number 30 or above, and the frequency of reapplication, if you're outdoors, should be every 1 to 2 hours. And if you're using a sunscreen, which has a chemical in it, not a physical block, you should make sure that it has adequate UVA and UVB protection.
Okay, and they said to get a second opinion. They asked you to do that?
No, when they say they send they're going to send the pathology to another place to have them analyze it.
I would imagine it's just that it's probably something that they want to toss around the diagnostic possibilities and then come up with a conclusion.
I know that it must be very nerve-wracking and scary, but it sounds like they have it under control.
Absolutely. This is a very common scenario, and it sounds like whoever you're seeing is doing a very good job.
Okay, well, thank you very much. I appreciate all your help.
Well, thank you very much for the call, Ed. And we are going to Pam from Springfield. Pam?
Yes, thank you. My son, when he was younger, is very fair-skinned. When he was younger, he didn't have any moles, but as he grew through the teenage years, his chest became connect the dots. And while we've had them looked at from time to time, nothing's ever really come up. As he gets older and moves, into his late 20s and 30s, will these moles stop growing, or are they going to continue?
There are two different reasons why people develop moles. There are congenital moles, and those are the moles that people are born with, and they're formed at or around the time of birth. And then there are acquired moles, and those are the moles that we develop, and usually into probably our early 20s. We'll continue to develop new moles, and for two reasons. One is a genetic susceptibility. So if you or his father have a lot of moles, he's going to have a genetic predisposition to make them as he grows older. The other reason people make a lot of moles is sun exposure when you're a child. So before the age of 5, if you get a lot of intense sun exposure, sunburns, you're outdoors a lot, that'll also promote the development of moles. But there does come a point where you do naturally stop making new moles.
Is this dangerous? That to have all those moles, you have to constantly check them?
Well, the more moles somebody has, the more they should be watched, meaning yearly skin checks. They should do their own self-skin exams once a month. There are risk factors for melanoma, and one of the risk factors is having greater than 100 moles on your body. So the more moles you have, it does put you at a slightly higher risk for developing.
And what about removal? If her son is, I don't know, how old did you say he is?
He's now 25, and I don't know anymore whether there's still more coming or not, because he, he wears a shirt all the time. He won't take a shirt off.
If he wanted to, would it be dangerous to have them, since there's so many, to have them removed?
It's a good question, and a lot of patients ask me that, well, let's just take them all off. And the answer is not to do that, because what ends up happening is that the patients look like Swiss cheese because they have these scars all over their body. And the interesting thing is that if somebody's going to develop a melanoma, it does not have to occur in a pre-existing mole. It can occur on skin that's perfectly normal and without any pigmented lesion on it. So demoling somebody, quote unquote, does not offer them any protection. So the best thing that your son can do is go for yearly skin checks.
Okay, great. And I have one question about me. For years I wore contacts. I no longer wear them, but my eyelids and the area just slightly underneath the eye, it has turned sort of a brownish color. Is there any way to lighten that?
Yes and no. I'm going to say yes and no because without seeing the area, I can't really speak to it as to whether it's just increased pigmentation or if there is something else going on. The tricky part is that because it's right around the eyelid, a lot of the lightening substances or bleaching creams are not really safe. But that's something I'm going to hedge on and say possibly, but you would really need to have it evaluated.
Okay, great. Thank you.
Okay, thank you very much for the call. And we do have to go to a break. Do we have Lisa from Chatham? Lisa?
Oh, Julie, I just love your show.
Oh, well, thank you. If you can hold on, we're going to a break. This is...
No problem.
Okay, this is Ask the Expert. Thank you. This is Ask the Expert. I'm Julie Briggs, and we're talking to Dr. Lisa Breslauer. We'll be right back.